Today on Keynote.
Culture isn't an add-on. It's everything about the organization. So if people who come in to work with you don't understand the organization, their ability to be successful in the organization is really compromised.
My name is Bill Russell. I'm a former CIO for a 16-hospital system and creator of This Week Health, where we are dedicated to transforming healthcare one connection at a time. Our Keynote show is designed to share conference-level value with you every week. Now, let's jump right into the episode. All right, it's Keynote, and today I am honored and excited to introduce a lot of you to Deborah Proctor. Deborah Proctor was the CEO at St. Joseph Health while I was CIO, and I'm really looking forward to this conversation. Deborah, welcome to the show.
Thank you, Bill.
I end up talking about you a lot in our 229 meetings, and I talk about my experience at St. Joe's. And I think sometimes people think I romanticize what it was like, but I also preface that by saying hardest job I've ever had in my life was being the CIO at a 16 hospital system. It was so challenging. But today I want to talk about being a CEO and setting the culture and all those things. Was that the hardest job you ever had, or was there a harder job you had?
No, definitely the hardest job I had. And it became harder the more years I was in the job as the environment of healthcare became harder because it forced us into some situations of contemplating mergers. And that was very difficult, stressful work. It's probably what caused me to retire when I did it.
It does take its toll. But let's start with, did you pursue the role of CEO? Did someone come alongside you at some point and say, hey, you could be a CEO? Talk a little bit about your journey.
Yeah, I started as a nurse. Trained as a nurse, and I was an intensive care nurse. And then I got a master's in nursing education, which meant I worked with nurses at the bedside to make sure they understood the physiology of what our care was and knew how to operate with the latest technology that we were using at the bedside and those kinds of things. But I found that in my career, I became bored about every 5 years. And so the first 5 I spent at St. Joe's, I was very happy doing that bedside clinical work. And then I became interested in broadly educating people. I decided that I was very interested in wanting to go to work for the system level of things. And so I was able to get a position within this system. I worked in education for a number of years. I worked with someone on organizational development. And then I worked with somebody else who was doing bioethics, which was very hot at that time in healthcare. So I split my time working between the two of them and became fascinated by both. And what I found, though, is I was trying to do 2 jobs at 100%, and rather than 2 jobs at 50% each. So I then decided I had to specialize in one. So I went towards the cultural side and became just very interested in how organizations work and what makes them tick and how do you accomplish things through the culture of an organization.
You were very early on in the holding company to an operating company, and moving from a holding company to an operating company are 2 entirely different cultures. A holding company really is 16 different entities, and I would imagine they felt like 16 different entities.
They weren't even aware of each other's existence. So seriously, they didn't do anything together. They were each operating in their local market. They had local boards, so they were driven by local boards. But when they decided to become a system, they still played very much to a distributed system, to where there was still major focus on the local level. That was the kind of culture they built for the organization, was locally driven. And at that time, everybody would say that across the industry, healthcare is local. We found out it isn't local, but that's what everybody drove at that time. So I had the organization for all the years between 1983 and when I came to the organization in 2005, operated with that local focus, but tried to collaborate on certain efforts that made sense for collaboration. A lot of that effort was around the mission of the organization. And you can't talk about St. Joe's without talking about how strongly driven it was by the Sisters of St. Joseph and their clarity about what their mission was.
I tell this story often. The first presentation I did, it was to you, the CFO, Chief Operating Officer, and I think the CIO. And we started into our presentation. I think we were like 5 slides in, and you said, "I need to stop you." I was like, "Okay."
That's
And
something I would do.
yeah, and you're like, "You need to be informed on who we are." So we had been predominantly working with the IT organization. So we were doing an IT presentation, and you felt it was really important for us to understand the mission of the organization. You went into the background of the sisters and how they came to Orange County and how they view healthcare and caring for that community and the ethos. And I think we had an hour meeting, and I think you took about 20 minutes right in the middle there to say, "Does this change your presentation?" And it did, which was really interesting to me.
Yeah, that's one of the things I reflect on when people say, "Hey, how did you build a values based culture or mission based culture?" I think they think about an add on. What do you do? There's the work of the organization, and then there's this work of adding on, getting people interested in values and mission and culture of the organization. Culture isn't an add on, it's everything about the organization. So if people who come in to work with you don't understand the organization, their ability to be successful in the organization is really compromised. But let me back up to one of your first questions, which was how did I get to be his CEO? Because I had never dreamed in my life of being a CEO. My career goal was to be a nurse. That was as far as it went. But I was working in another Catholic health organization in the late 90s. And I had one of the sisters in that organization approach me and say, "Why aren't you a CEO?" And I said, "Sister, I've never thought of being, I've never contemplated being a CEO. I don't know that I could do that job." And she said, "You absolutely could do that job. And we in Catholic healthcare need more women in leadership." The field of Catholic healthcare for all its years in the early 1900s, well up into the 1990s, was driven by Catholic women. I mean, by the nuns. And they were the leaders, they were the providers, they were the whole thing. And for them, it was a ministry. And I mention that because that was essential to our culture at St. Joe's, is returning it to the concept of being a ministry and not just a business. That's what caused me to decide to look for a job. And after she said that to me, I just happened to hear that the CEO at St. Joseph Healthcare was leaving. And I thought maybe I could do this.
I love your story of the interview process. And so you're interviewing against heavy hitters. You're interviewing against CEOs who have been established CEOs of health systems and that kind of stuff. Talk a little bit about the interview because I just love the story.
There's a couple of stories that were instrumental and important in what happened during my interview. The first was I was down to the final two candidates, and I started to have real doubts about being able to do this job. And one of the things that concerned me was I had such devotion to the sisters. I thought if I took over their ministry and messed it up, I would just feel horrible about that. It would destroy me. And so I was very worried. And I called the recruiter and I said, "I don't think I can do this." And she said, "You must do this. This is really important for you and you have a really good chance." And I said, "Okay, I'll reflect on it." And I realized that I hadn't ever been to the website Because I knew the organization so well, I didn't have to go to a website to get information about it. And so I went to the website, just decided to peruse it, and across the top was a banner. And that banner happened to be the Bible verse that I carried with me every day. And it was to act justly, love tenderly, and walk humbly with your God. And it was a slap in the face of this is something I should not back away from, that this is consistent with who I am and what my values are. The other funny story during that time was that on the final interview day, I was flying in from Phoenix. I happened to live in Tucson at the time, but I was flying over from Phoenix the night before for an 8 o'clock interview. And I got to the airport and my flight was delayed and it was delayed. And all of a sudden, I heard him say at 10 o'clock at night that it was being canceled. And I'm sitting in Phoenix at 10 o'clock and have an 8 o'clock interview in LA the next day. So I rented a car service and had the car service drive me over. And that's about a 6.5 hour drive. Got to the hotel about 3:30 in the morning for this 8 o'clock interview. I went into the interview that morning in I was waiting in a waiting area and I was just trying to prepare myself and be calm. And I said a prayer that happened to be a prayer that I liked a lot. And as I was saying the prayer, the board chair came in and said it was time for the interview. And I went into the room and the board chair said, Deborah, as we start all of our meetings with a reflection, with a prayer. And what was on the table as the reflection for that morning was the prayer that I had just been praying in the other room. And so it just felt like it was a moment in time where everything was coming together.
It's one of those things, it's really interesting to me. I've interviewed a lot of people over the last 8 years. And one of the things I heard early on from a strong female CIO who was in New York City, and she goes, Bill, if there's a job description and there's 10 items, and a woman looks at it and says, I only have 7 of those items, she likely will not apply because she wants to be all 10 of those items. Whereas a man sees it and they say, I have 3 of those items, I'm going to apply. And she says that's a very common thing that happens over and over again. And she cited it as one of the reasons there aren't more women in leadership. And she encourages them to say, you know what, go with the 7, you'll develop the 3 as you go, or you'll hire people that can do those 3 as you go. Like, just put yourself out there and go for those roles. And your story sort of illustrates that, of even up until the last minute, you going, I'm not sure I could do this role.
Yeah. Yeah. When you think about it, I had worked at the organization 14 years in my first go around with St. Joe's. Then I had left for 15 years. And so I had a great deal of familiarity with the organization. I was a nurse by background, which certainly brought something unique to the CEO role. I had a real focus on culture, which the sisters knew that there was something important about what they were doing, but I don't know that they could have named it as culture. And so I think when you put all those things together, and I had a great deal of experience in many different organizations. I worked in the system organization. Then I worked for an association of 1,000 hospitals. And then I worked for a consulting firm. And then I worked for another Catholic health organization. So I had a variety of experiences, which is unusual for women also. Women tend to get a job and stay with a job as versus see what job would advance their career. And most men are thinking about what's the next step in their career? How do they advance it?
Yeah. So I want to delve into culture. Let's start with this because there's so many elements of culture at St. Joe's. There's values in action, there's sponsorship, I went on the pilgrimage. I forget what it was called, but there was an onboarding.
Launch. A
Yeah.
launch.
But then there was also a 3-year thing. It was very intentional. Everything about it. I can still tell you to extend the healing ministry of Jesus Christ and the tradition of the Sisters of St. Joseph. It's There was so much of it that just was intentional. Why is culture important?
Simple way to think about it is culture is the way we get things done around here. And understanding culture is not the only thing. I believe strongly that you have to have a clear mission. You have to have an energizing vision statement. You have to have underlying values. Then you have the culture that allows you to achieve all that. It's the way we get things done. So you remember the mission really clearly because we focused on the mission a lot and we went over it in things that we did when Tom Peters wrote a book and talked about values in an organization and placing your values statement on the wall. And so a lot of people got in line and named their values. It became a traditional thing to do. But as I said, they were just values on a wall. They didn't mean anything. Culture is taking that mission and those values and putting it to work and figuring out how do we successfully get the results that we intended from our mission and from our vision and from our values. I have a view that a lot of organizations have a mission statement and they have a vision statement that is really wordy because they try to put everything they could into the vision statement when they talked about it, and somebody would add another piece and another piece. And so you have these really long vision statements, and then they have values. What's missing is they then go to strategy. There's an important step that I think goes before that, which is you have to ask yourself, how will we measure that we have achieved this mission and this vision? How will we know when we're there? So at St. George, when I got there was a clear mission statement. There was a foggy value statement, but it was there. It had three parts to it. And then there were values. And one of the first efforts that I did was to bring together management, doctors, the board, our sponsors who were the sisters. And we tried to get clarity on what were these measurements? How are we going to know when these things were successful? We did a 3-day intensive retreat where we worked for about 12 hours a day trying to do this work. And we came out with 3 things that were very easy to remember. And this is what we said we were about. And we were about perfect care, which was making sure that 100% of our patients got perfect care 100% of the time. Community health, which meant we would be in the top percentile of healthy communities in the country. And sacred encounters, 100% of our encounters would be sacred in nature. Again, this goes back to culture and understanding we're not just about customer service, we're about creating a sacred event in all of our interactions. Those 3 things got put into place, and then we built all sorts of things within the organization to have people understand those things. As you said, one of the very successful programs was Values in Action. Values in Action took the 4 values, and every organization nominated people in the organization who represented one or more of those values.
It was awesome the one year I got to review those stories. They were amazing stories of people who are really giving their full self to the organization. They were developing these stories where the patients were talking about just the impact they had on their family and their lives because they showed them dignity from the parking lot to the hospital. I'm reading these stories going, I am so proud to be a part of this organization.
The first year we did it, I couldn't believe it. Letting people know what it looks like when it's done right is important. We can talk all the words we want to, but how do I know what this means? Values in Action was one way of that. Pilgrimage was an entirely different approach to things. That was a program we put together where we took the management, again, the doctors, the board, a trip through the history of the sisters, the important points where they had started their ministry, When they were called into ministry back around the 1600s, that they were called into action by a bishop who told the sisters to go out into the neighborhood, find what the needs of the people were in the neighborhood, and then meet those needs. That was their work. So we took leadership to the places where the sisters had started this work and walked them through an understanding. And it wasn't just a tour. You actually did work and reflected on things while you were on the pilgrimage. It was actually very deep inner work to reflect on things. But again, what I wanted was people to understand who the sisters were so that we could lead in their same way. Another important part of that was the sisters have something they call a charism, something that represents who they are and how they want to be in the world. And the Sisters of St. Joseph's charism was unity and reconciliation. Those two things became critical in how we operated as a system. We always had at the front of our mind is what we're doing, fostering unity, and is it fostering reconciliation in the world? So it wasn't just putting value statements on the wall, it was giving all these ways for people to experience what this meant.
Let me tell you how I experienced it. First of all, I was one of those crazy leaders that you hired who needed this whole thing. Remember, the work of Father Madai sending the sisters into the community still impacts me today. People will say to me, it's like, what's distinct about your organization? I'm like, we're just filling gaps. We just go out and talk to the CIOs and the CISOs and the CTOs, and we ask them, how could we help you? And then they tell us, and then we do those things. And how's that different from your competitors? I'm like, my competitors start with, how do I make money? How do I make more money? How do I make more revenue? And they end up in the wrong place because they lose connection. And it's interesting because there's a story when I was at St. Joe's, we were building a new portal, right? And this was going to be the portal for the community. And I remember we went to the organization and they gave us these 10 things. These are the 10 things that should be in the portal. And we had prioritized these. We started building it and everything else. And then somewhere along the line, somebody said, have you talked to patients? And this is so obvious. And a lot of organizations have, and we had patient councils and that kind of stuff. So we did. We went out and talked to patients, and it turned out that the number 10 item was the most important to the patient, and the number 9 item was the most important to the patient. Number 1 item was like the 10th most important, and it was like completely flipped. And we had spent so much time developing the top 3 based on what we perceived instead of what they really needed or wanted from us as a system. It's interesting that just one aspect of culture, go talk to them. What are their needs? And then respond to their needs. The sisters going and saying, hey, we're going to be teachers, and then establishing hospitals because that was the need.
That was the need. Yeah.
It's really interesting. I want to go a little bit more into sponsorship. One of the most impactful meetings I think I ever had was with you and Theo. And it wasn't an easy meeting because you were very honest with me of some of my deficiencies as a leader within St. Joe, some of the things I could develop. But I think one of the things that made that meeting so valuable was we didn't only talk about some of the challenges that I was having. One of the things you did in that sponsorship meeting was you took ownership for my success, and you alluded to that in the meeting. And when I walked out of there, I never felt more valued as a leader in an organization as I did coming out of that meeting, even though I was told some very challenging things of things I would need to develop in order to be a more effective leader.
Well, I'm glad to hear you felt that way, because that's certainly what it was intended to do. The concept of sponsorship is, I think, very unique. And if you look across most organizations, you'll hear the term mentorship, or you'll hear about coaching, or you'll hear about partnering. Sponsorship is so much more than that. It is a personal commitment, an investment in the success of the person you are sponsoring. And that sounds like part of what you felt, Bill, is that there was a commitment to helping you be successful in the organization. So much of what we do is we hire people, we tell them what we want in terms of performance objectives and things, but we don't tell them how to be successful at achieving those in the organization. And there are ways organizations work. And you may have come from an organization where everybody was very direct and that you had to be direct and quick in your response and short in how you presented things. I'm just making these up, but that could be one type of culture. You come into another type of culture where things have to be thought over, they have to be deliberated upon. So St. Joe's is a great example of that kind of culture. When we did things in St. Joe's, we had a discernment process, a process for going through and saying, is this the right thing for us to do when you look at our mission and when you look at our values? And it may make sense in terms of what the rest of the industry is doing, but it may not make sense for us because that's not the culture we want in our organization. So the thing about sponsorship is when you have a group of leaders that you're responsible for, if you can't sponsor one of those leaders, if you don't feel that you could put the level of commitment into making them successful in the organization, then you know you've got a misfit in your leadership organization. If you're not willing to sponsor them, then there's a problem.
Then you probably shouldn't have hired them if you're not willing to sponsor them. Is what I,
You probably need to move them out of the organization or into another place where they'll be more of a fit. Because in sponsorship, I'm saying to you, I'm going to ensure you're successful and I'm going to do everything I can to ensure you have to do your part. And your part is to bring your best self and what you were hired for to the job and to get those things done that we've agreed upon that you're going to get done. My job as your sponsor is to move obstacles out of the way so that can happen.
but it doesn't mean you're not going to fire me if I don't get the job done. Is that?
No, it doesn't mean that at all. If not only if you don't get the job done, but if you don't do it in a way that's consistent with the culture of our organization.
That's interesting. You could get the job done in an inconsistent way with the values and the culture of the organization, and that creates havoc within the organization.
Absolutely.
And you have to deal with that as well.
I had a team member at one time who was brilliant and brought so much to the organization in terms of brilliance. And I could recognize that brilliance and wanted to keep it in the organization as a driver for us because the leader was someone who challenged a lot. And that can be very useful in an organization, or it can be very destructive and cause a problem. I sponsored this individual for probably longer than I should have because I really believed that there was a concern about the mission and there was a brilliance around the strategy and the outcomes we needed to achieve, but there was not the commitment to the values in the same way, and the way the person interacted with all parts of the organization, their own team, the individual hospitals. I was always having to put out fires for this individual. And I thought to myself one day, I can't sponsor this leader any longer because I don't believe I can make them successful. I can remove all the obstacles in the world that are in the way, but the biggest obstacle is the way this person thinks and operates, and that wasn't changeable.
Yeah. I want to hit on a few things that I think we're just thinking, man, we could talk for the next 3 hours, I have a feeling, but there's a couple of stories I relate to people. They look at me incredulously. That really wasn't the case. And the first one, I remember budget meeting. And one of the things that you were notorious for, and I think notorious is the right word, is you wouldn't give us a budget number to start. You would say, go in the culture and the values and the mission and what we're trying to accomplish, the healthiest communities, perfect care, sacred encounters. What should we do? And we'd always get frustrated with you. We'd be like, Deborah, how much money do we have to spend? And you'd say, No, what should we do? And you would tell us if it needs to be done, and if it's enough of a priority, we will go find the money. Is my recollection correct there? Because when I relay this story to people, they just look at me like, what? I don't even understand that budgeting process. But that's how I remember it. Is that pretty accurate?
You're accurate. When I got there was always a budget number developed by the finance department that said, this is what we're aiming for this particular year. And then plans were built around that amount of investment. To me, again, it's backwards. And I go back to you've got this mission and you have a vision in your mind, and now you've got these outcomes that you've identified. And to get to those outcomes, you have to make investments. So my belief was, what are the things we need to do next year? What are the things we need to invest in next year for us to achieve those goals? And then I did say that we would go out and find the money, but there also was a recognition that we couldn't do everything. And so we had to prioritize those. The thing that was the most different about that process was the hospitals had put their individual budgets together in the past. And they would say, this is what we need. And then we would roll it up and see what it added up to. Again, I was trying to create an organization that moved collectively towards a set of outcomes. And I involved the CEOs in judging everything that was being asked for. That the CEO couldn't just argue for their things. We had a process by which we put everything on the table, everything that had been asked for, and then prioritize those according to what we had to achieve in our outcomes. So you might have needed something in IT that you wanted. It's not necessarily that you needed it, but you wanted it. And it might be outweighed by the needs of one of the local hospitals because there was something major that needed to happen there.
The next thing I want to talk about, prioritization of projects, is still, I think this took years off my life. It probably took years off your leadership life. It was so difficult, man. The conversations were painting this culture. It didn't mean that we all got along and we hugged each other after every prioritization meeting. They were very difficult meetings.
They were extremely difficult.
Yeah. And it was like, are you saying we shouldn't get this new MRI? Are you saying we shouldn't do cancer care in this way in this community? And you're sitting there balancing these things. And I'm sitting there going, hey, I need a new data center. And people are like, data center? That process was so difficult. What would you say to people who are struggling with that today?
I guess I would say we know there is a limit to what we can spend. It's not limitless. Without having those 4 pieces in place, the mission, vision, values, and outcomes, that's what we call those 3 pillars, were outcomes. And without having those in place, you're making random decisions. You are making decisions of investment by fiat, because on what basis are you deciding that there needs to be a cancer center versus a data center? Because both of those are critical to the organization at some time. And we couldn't give the best cancer care without having access to data that supported what the needs were in our community. So a data center was important, even though it didn't sound as important as cancer care. I think there just has to be real clarity about what drives what to lead to a set of outcomes. And you can argue for days on this. The leader of the organization has to be the final word, because you can vote, you can prioritize collectively, but at some place there's tough decisions to make.
It was interesting for anyone who thinks Deborah was not a strong leader. First of all, the fact that you brought all those voices to the table is sometimes distinct in organizations, that you wanted all that feedback. But one of the things that to this day I think is pretty amazing is you had a very strong executive president's council, whichever one was the smaller group. of leaders. They were very strong, very opinionated, and they've all gone on to really successful careers. They were brilliant group of people. That's the group of people that you sat in there and were making those decisions. But one of the things that was distinct is you essentially said to them, there's 11 votes, but at the end of the day, you could trump the whole thing and say, nope, this is what we're going to do. Now, I only remember you doing that once. You may have done it more than that, but for the most part, you made it clear. It's this is my decision. I will take ownership and responsibility for making this decision, right, wrong, or indifferent, but this is how it's going to be.
I think that's something that leaders have to be willing to do, to stand up and say, this part is my decision, and I will take the accolades or the punishment at the end of the day. I heard this term, and I don't remember where I heard it from, but it had a big influence on my management, which was the term decision ripoff. And decision ripoff is when you invite people to the table and ask them to give input, and they think they are making the decision, and then you make the decision anyway. You have to be clear when you're involving people who is the ultimate decision maker, or people will experience decision ripoff. Wait a minute, you told me I was involved in this, but you chose something different than I said. So that to me was a really important concept of making sure people knew when I was going to make a decision and when I was letting the decision be made by a group, by another individual than myself. There had to be clarity about that. Who's got the ultimate decision making? Because it really changes your organization culture again if people experience decision ripoff on a frequent basis.
And it leads to one of my favorite things that you introduced me to, which was the concept of the silent veto. And as an IT leader, I experience this all the time where like we went through the governance process, we decided to do a project and away we went. And I'd go to the first hospital and things would go well. And I'd go to the second one and things would go well. I'd go to the third and I couldn't get resources assigned. I couldn't get stuff responded to. I couldn't, whatever. And that was so explain the concept of the silent veto. I think I just gave an example of it, but
I think you did perfectly. It's when somebody just refuses to work around the decision that's been agreed to, they're essentially not saying anything, but they're silently vetoing the project.
hated that.
I very much hated that. People are always asking me what characteristics do I look for in a leader. One of the most important characteristics for me is trust and the ability to build and maintain trust. And the silent veto takes all of that away. Undermining is really just more than I could handle. But there are three things I think I look for in leadership that are the first is commitment. And it's commitment to what we've talked about, the mission, vision, and values. And I have to believe that the leaders I'm working with are committed to achieving what we're setting out to achieve. The second thing is there has to be a willingness to be a part of a leadership community. That's a whole nother idea, the idea of community. It's different than being part of a team. The community applies something deeper where there's a shared commitment to each other. And the third thing you have to do is be able to make courageous decisions. And if I could say there's one thing I see lacking in Washington, and I see lacking in businesses, and I see lacking in different places where I interact in the world, is this idea of courageous leadership. Having the courage to say, we're going to do this in spite of what you all might think. I'll give you a perfect example of this. When I got to St. Joe's, there was a movement in Northern California to unionize our employees. And the union in that area was very active, and they were aggressively pursuing one of our ministries. I have to give a little context here. The Catholic Church has a position that supports unions. It does not say you have to be unionized in a Catholic organization, but it says employees have the right to unionize. So again, within my setting of a Catholic ministry, I looked at what we were doing in the union battle, and I did not agree with many of the things that we were doing, which were the typical things people do to keep a union out of the organization: put out negative information about the union, present the union in a different way to the community, not allow employees to have that vocal opinion about forming a union. And I made the decision that if our organization was going to reflect the Sisters of St. Joseph's, who were focused on unity and reconciliation, we could not engage in anti union behaviors. A lot of the CEOs felt that I was rolling over to the unions and just saying, come in and unionize us. Nothing could be further from the truth. I didn't particularly want to see unions in our organizations, but I had to accept this concept that employees have the right to unionize. What rights there are beyond that are fairly limited, except what's set by the National Labor Relations Board. But trying to get our organizations to understand that we would not hire union busters, that wasn't okay in our organization. And I did this in the first year that I was the CEO, and I was not winning friends at the local level in Northern California, and who really just felt that I was rolling over. I can proudly say that in the 11 years we were there, we only had one union actually win an election in the whole organization across the multiple organizations that we had. And so I wasn't rolling over, I wasn't giving in. So all I'm saying there is it took a lot of courage for me to take a stand that was so different than what had been taken in the organization. But I feel like that's what a leader is there for, is to take those kind of courageous actions to get the mission accomplished.
I have now new appreciation when when I read a story in the press, I'm just like, yeah, but that leader has much more information than I just received. And that's a case where you're sitting there going, hey, the reason we didn't sign this paper is because we want to have dialogue. We want to have conversations. We want to hear people's concerns directly from them. And we don't want to relinquish that to have a conversation with our employees. I remember one time they were trying to form, and I remember somebody saying, they're asking for benefits that are less than what they already have. And that's
Yeah,
really how you combat a union is you give people a great work environment and you pay them fairly in the top
right.
percentile, and you essentially listen to them and continue to iterate the environment to help them to deliver on their aspirations and goals.
And that's what we were trying to demonstrate to the community, is that we were providing all of those things. But again, the trick was, how do I walk a behavioral line that supports the employee's right to unionize against just turning over and letting the unions take over without us having any ability to talk to our employees.
Let me close with this. This has been a marathon. I appreciate you doing this. I want to touch on your healthcare situation. You're now experiencing healthcare from the other side, right? So I'd love for you to talk a little bit about that, but I'd also like for you to maybe close with, if you could wave your magic wand and fix one thing about healthcare at this point, what would you like to see fixed if you could just make it happen?
I think the biggest thing is fixing the payment system, because I think the payment system constantly interferes with our ability to deliver care in the way we think it should be delivered. I think the role of insurance and big pharma and other things are really important in terms of ever being able to restructure our system successfully. And I don't know how that's going to be done. I don't know if it's possible to wave a magic wand. I've been thinking about this for the last 40 years, and we've still not significantly changed our payment system in any way that allows us to, as I said, deliver care the way we want to. So that's what I would magically do, is have a payment system where people are aligned around the same incentives. I think it's crazy that we have an illness system, not a health system. We pay for illness. We don't pay for wellness. That concept is crazy. And it's just really frustrating to be able to see a way in which we'll ever be more successful in changing the health of our communities. I worked on healthy communities a lot, and our communities are sicker today than they were at the time I was working on them at St. Joe's, because the problems have just continued to multiply. So that's the one thing I would do if I could do anything.
Yeah, getting alignment. I know that when I go to the grocery store, there's more things against me in that grocery store than there are for me in that grocery store. And there's very powerful marketing people and brand people and whatever, making sure that I do things that aren't necessarily in the best interest of my health. And that's only the tip of the iceberg, because you mentioned alignment, provider, payer, pharma. We love the advancements that are going on in pharma. Miracle drugs and great things are happening in pharma. But then when we see the cost of those drugs hit the system, and then payers decide they're not going to pay for that, there's not alignment across the board. And as you say, that's going to take courageous leadership somewhere along the line, and probably people that are maybe smarter than we've been over the last 40 years.
There were times that while I was in the industry that I really felt we might get something accomplished. Whether you liked her or didn't like her, Hillary Clinton led a huge effort to make the changes we needed to make in our health system. Whether you agreed with her solutions, she was really pointed at all the things that we would like to see change. And I think Obamacare, it was again an effort to really try and do things differently. But there's been, when you consider the massive amount of energy and dollars that went into those efforts, we've had very little change as a result. Our outcome measures are worse in many areas. Our prenatal care and our infant mortality rate is one of the highest in the world. I don't understand how that can be in a country like our own. So it's going to take two incredible things: a will to do it, a courage to do it, and second, the ability to build a partnership and a collaboration that will allow for that kind of change. And I don't have much hope for that in our current environment. I think everything speaks differently to that we're getting the opposite. We're getting deeper divides rather than closer collaboration.
Well, Deborah, I want to thank you for coming on the show. And I also want to just thank you for your role in my career, in my development as well, and giving me the opportunity, because you are one of the people that was part of my hiring process. And I'm not sure if you would have done it again, but I appreciate you doing it that one time and hiring me in.
No, that's not true, Bill. I would absolutely have done it again. You brought something very important to St. Joe's that we hadn't been able to accomplish along the collective integration around a set of technology infrastructure that would support our success. And I think you were a great team member to work with.
I also tell this story, and it's a story of your humility. I remember going into your office and you essentially saying to me, "We haven't been able to do this. I don't know this area. I want you to educate me. Like, we're going to meet." I think we decided to meet on a monthly basis. And those conversations were as much me talking to you about technology and where it's going and how to think about it, and you teaching me how to survive in a healthcare environment and explaining to me, if this is how you get that done at that ministry, and this is how you approach that differently, and this is how you get things done. And that was a really great back and forth on you as an older leader at that point saying, "Hey, this is an area that's a little bit of a blind spot for me. Teach me."
Thank you, Bill. And I look forward to talking to you again soon.
Absolutely. Thanks for listening to this week's Keynote. If you found value, share it with a peer. It's a great chance to discuss and in some cases start a mentoring relationship. One way you can support the show is to subscribe and leave us a rating. Love it if you could do that. Thanks for listening. That's all for now.